Good afternoon. Another live video on YouTube about medical questions. Before anybody arrives, I want people to see who see this after it's been recorded to know that this was recorded on a Sunday afternoon in late May, and it's not actually live right now for you. But you can still write comments about the video in the comments below, and I will read them because I read all of the comments. For those of you who are participating in this live right now, thanks for joining me. Many of you may have actually participated in yesterday afternoon's video, which is unlisted. I'm experimenting today by letting the video actually go out on the regular channel with all of the produced videos we do twice a week on Tuesday and Friday afternoons. And we've already got people participating here with the discussion with Crystal M saying good evening. LeeAnn saying hi. Hi guys. Good evening to you also. Everybody's welcome to participate in the chat part. If you want to do the super chat, you're welcome to do that too. What that will get you for whatever money you give is you will get all of my attention until another super chat comes along. Hannah, hey. Audrey, good to have you back again today. Thank you for your questions yesterday. In fact, yeah, your question was the question of yesterday's talk, the cholesterol. So, Audrey, that was a very good one. That got me on a topic. Lady J, good to see you here. Also, Alyssa Walker is here. And Marlies, hello. Hannah, I'm going to give you my questions of my medical thing. And Steve Hopp, hello. Remember, Hannah, to phrase your question in the form of a general medical topic, not a personal, I have this such and such. That'll work better. Claire, we're glad to have you again today. Thank you. Welcome coming back. Lita131, we're glad that you love Auburn Medical Group. Audrey, we're glad that you love it too. And so I guess we're waiting on, was it Claire who actually had a specific medical topic that we're going to discuss? If so, oh, Petra, oh my goodness. Hi, Petra. What time is it in Sweden? And we're so happy to hear that you're getting better. All of you who follow somewhat closely or on Patreon know that Petra was having the surgery and was having problems with infection and is now doing better. So that's very good to hear. And Petra, please do give us an update so that everybody can know what the latest is this week and on how you're doing. Lita131 loves the earwax extractions. Interesting you bring that subject up because I'm having a conversation on the phone with some earwax removal people tomorrow. We'll see what that's all about. I'm not sure where that's going to go. I'm thinking that I might want to set up some kind of a little study of my own where I compare theirs against the major brands. BooBoo, good to see you. Alyssa just graduated from phlebotomy school. All right, so you're going to be doing some blood drawing. She's going to be a vampire. Hannah was saying something about carpal tunnel. Let's see if I can bring that back. Oops. Whoa, how do you get out of that? Carpal tunnel. Why does it hurt so long and suddenly stop? Usually it doesn't stop suddenly, but once the inflammation gets down to a certain point that the nerve's not touching anything anymore, there's no reason for there to be pain. And Lita loves pimple popping, which we actually may talk to a person with blackheads tomorrow at work. And we'll see if that ends up in a video. We're not sure. Norma Jean Green, hello, finally made it to a live one. Yes, Norma Jean, you found one. So you have all your alerts or your notifications set up correctly. And that's something I should say to the people who are watching this after the recording, that if you missed this when it was live and you wish you could see them, you have to go into my channel, find the little bell icon and click on it and activate your notifications in your settings on YouTube so you can get either notifications on your mobile device or get an email. Oh, Petra, 1:08 in the morning. Oh, I don't mean to keep you up. Steve Hopp. Definitely a favorite medical channel. I like the doctor trying to teach rather than shock by showing only gross out extractions and such. I like that part, LL. Jason also, you're a great doctor. Enjoy watching your videos. In North Carolina, thank you, Jason, North Carolina. We're glad to have you be a part of it. Alyssa Walker, how long have you been a doctor? Let's see. It's been 21 years. 21 years. Is eczema made worse by stress? Yes, boo-boo, it is. Lita, ooh, this morning I cleaned out my earwax Q-tip, pulled out this gunk. It was gross. Ooh, wow. I need a lot of that gunk, but I don't think we're going to have you send it to us. I'll try to collect my own in case I do that study comparing the different over-the-counter earwax removal products. Do you fatty tumors? Rebecca Thompson. I have in the past taken fatty tumors out. I've enjoyed it. Here's the problem, though. Usually the contracts are set up for surgeons to remove fatty tumors because they're deep. They're below the dermis. And if I don't get paid for it, I'm not going to do it, especially since it involves going deeper than anything else we do. So there's added risk. So we really, and we're not the most set up for it. We don't have cautery in our office. If we did, and if we got paid for it, yeah, I'd be doing them. Absolutely. if they need to be. Most of them don't need to be taken out. Most of them are benign. Well, I shouldn't say most. If it's just a fatty tumor, if it's just a lipoma, it is benign, and most of them don't cause any pain or any problem. Okay, where we're located? We're located in Auburn, California. We'll trigger finger away without surgery. Sometimes. Lita picks or it didn't happen. Agreed. Except I don't know how she'd give them to us now. I guess you could post them on the Patreon. You can post pictures on the patrons can post pictures on the Patreon Auburn Medical Group. It's found at patreon.com/Auburn Medical Group. Steve would love to play with the liquid nitrogen. Oh, it's fun stuff. Alyssa, what are some signs someone should be looking for in the event they could have a lot of earwax buildup? Well, all the things that go along with some more serious ear problems. And that would be a full sensation, tinnitus or ring of the ears, and decreased hearing. Baker's cysts, what are some signs? Learned so much about proper ear cleaning. Big thanks for your videos. Greetings from Germany. Oh my goodness, middle of the night in Germany. Thank you so much, Lynn Chibi, for watching us in the middle of the night in Germany. That's so cool that people all over the Western Hemisphere are catching this right now. Have you ever froze something for the fun of it? Oh, yeah, we do all the time. Not on people's bodies, though. Too late. Already in the garbage. LOL. Leader, remember to share next time. Yes. Petra is so much better. The wound's healing nicely now. Only have to go and change the dressing every other day. Good. Oh, that's great to hear. Alita, could green tea be used to clean out the ears? As well as any other liquid could, but it's not necessarily going to help you with the wax any more than water, to my knowledge, as far as any studies I've come across. How hard is medical school? I want to be able to, oh, it's easy. You go do it. Petra, hearts for Petra. Gross, how serious are benign stomach tumors? They can cause problems. Some benign tumors of the stomach can actually cause problems with acid production and with some early fullness when you're eating and decreasing the amount of room for stuff to come through. But they're not going to spread around and kill you through cancer spreading. Oh my goodness, always nearly right from the UK. Thank you for being a part of things here and letting us know you're here. Melissa DiMartino, hello everyone. Now, Melissa is one of the very few that's ever done a super chat. So Melissa, you get special hello, Melissa. And Petra, couldn't sleep. I'm so happy you came. Well, I'm sorry that you can't. You have insomnia a lot. We should do another thing on insomnia. I know we've done it in the past, and I think you've even been a part of that, one of our insomnia talks, where we go over sleep hygiene. If anybody hasn't seen it, just Google sleep hygiene. You'll probably get good source of information. But of course, my favorite thing for sleep that I'm wanting to get somebody to try to tell me about is CBT4, FOR, CBT4insomnia.com. Cognitive behavioral therapy for insomnia. I'm hoping that will be a big help to a lot of people. A vibration in their ear, for some reason why, that's probably a form of tinnitus, but could also be from blood flow from the carotid artery, the internal carotid artery, and needs to be checked with some vascular studies. Are the conditions that prevent skin sloughing, like vitamin D? Not vitamin D, no. And usually if someone has actual skin sloughing, it's a much more serious problem than any vitamin is going to address, like vitamin A or vitamin K, because it's going to, or vitamin A, excuse me, because it's going to be a problem with actually the body making something that just vitamin deficiency isn't the problem. Sounds like you're talking about serious disorders people can have, like epidermolysis bullosa. Is that how it's pronounced? Very serious conditions where people actually are losing their protective layer around their bodies, their skin. It's just sloughing right off. Rosemary Weeks loves medical video, and BooBoo Kitty's so happy that Petra's feeling better. Explain gastroparesis we did yesterday. Check yesterday's video. And if you can't get to it, look on our Facebook for the link to it, or my Twitter, at Dr. Vaughan. Lita is essential oil diffuser. I'll skip essential oils. Hannah is so much better. Lita also makes the room smell good. That's a good thing. Petra is giving thanks to BooBoo for her well-wishing. Real quickly, gastroparesis is a slowing of transit of material through the stomach because for some reason the nerves aren't working, so it's not moving much. Food gets blocked up. You can treat it with a couple of medicines called prokinetic agents, which they promote movement, like metoclopramide or I can't come up with Reglan is the brand name for it that help to move things along. Often found in people with nerve problems and diabetics. Wow, I did the whole subject that quickly while waiting for Sharon Calvert to say hi. Hi, Sharon. Glad to have you be a part of things. Wow, that was a lot. Okay, we'll talk a little bit about sleep hygiene. Since somebody mentioned something about insomnia, sleep hygiene, or maybe it's because I was just talking about Petra. Sorry, Doc, what are your thoughts on Botox for helping with migraine? I am always, I was reading your name, I'm totally in favor of it. It's a great way for people to have maintenance to keep the migraines from coming back. They go in every so many weeks and get the injections. I don't do it myself. I had the choice of doing either the training for that or doing the training for the migraine nerve blocks of the greater and lesser occipital nerves. Actually, you could also do it with the supratrochlear nerve and the supraorbital nerves. And so I did the nerve block training instead, which treats a headache that's already established. And you see a couple. Do we have 2 videos of those? I don't know if I have 2 videos of those. I think we might have 2 videos of those. But I've had 2 just great cases ever since getting the training. One definitely is on a video where the lady talks about getting the relief of her headache. And then the other one, the patient didn't want to do the video, but had great relief of her headache from getting that nerve block. Is it possible to get heart cancer or no? Because actually there are cancers of the muscles, sarcomas that occur in the muscle, but I've not seen one in the heart muscle itself. But I might look into that. What causes fluid around your heart? I'm from UK. Hey, Rosemary, welcome. Bye, Dr. Cialita. Thank you for sticking around as long as you could. Karen, what would cause wrist to crack while crocheting? Oh, that's the crocheting that's causing it. Petra Rosenberg, if it's while you're crocheting anyway. If it's while you're writing, it's the writing. Petra Rosenberg, yes, I really need to sleep now. Yesterday I slept 5 hours in a row. That's the longest I slept for 9 weeks now because of all the pain. Oh, okay. And Claire, is the block like you get is the block? People can use nerve blocks for surgery, as a local anesthetic, or I shouldn't say local, it's actually a nerve block, regional block usually. And yes, that can be used for certain types of surgery. It's all up to the surgeon whether they want somebody who can still be awake and move around during the procedure. If they don't want somebody able to be awake and move around, they're going to have general anesthesia, like intra-abdominal. Some of the orthopedic surgeons will do general, even though it's just an extremity they're operating on, simply because they're going to be moving a lot of stuff around and they can't have the patient voluntarily moving it, so they need it totally paralyzed. That requires general anesthesia to accomplish that. Audrey's leaving us too, boy. But Audrey, it was good to have you here. And Petra is saying goodbye to people. Can you explain Stevens-Johnson syndrome and BooBoo? Only curious about the cancer. Thanks for the answer. Rainbow Infinity 428 asks, can you explain Stevens-Johnson syndrome? I can't do a good job of it. It's a reaction where people get a rash in response to a type of infection, oftentimes treated with steroids. It can even look like a burn. It can be so severe. And it can be very serious for the patient, too. Okay, seeing as that kind of brings us to the end of a short little live video of talking about a few medical topics. We'll look forward to having this on for the regular channel for people to see, and we'll do another one of these sooner. I'm sorry I haven't been doing as much lately. And everybody, be sure you're subscribed and check us out on Patreon at patreon.com/Auburn Medical Group. I think people are Googling obscure health conditions to test you. I think so. So always nearly right. We'll see you guys next time. Until then, this is Dr. Mark Vaughan telling you to stay in good health.